Perfect. So since I have you for such a short time, I'm gonna go ahead and gonna say welcome to everybody. I've got some friends, I've got colleagues, and I've got more here. But what I really wanted to have is to have a conversation about where we are across the region around opioid remediation. Many people refer to it as opioid settlement. But what I want to do is I'm going to let folks introduce themselves real quick because I know that we're losing Greg early at the half hour mark. So, Greg, I'm going to let you introduce yourself first. Who are you? What do you do? And why are you here today?
Sure. Thanks, Tony. Greg Puckett, I'm Executive Director with Community Connections. I've been here for 23 years, but I've been a county commissioner for the last 9 years here in Mercer County, West Virginia, and also involved with the National Association of Counties Opioid Task Force, which creates a lot of the stuff around how these funds are to be spent, or at least the suggestions to be spent. So hopefully a lot of community-based groups and a lot of coalitions are going to get this money to solve the problem. So thank you.
Perfect, perfect, perfect. Josh, where are you? Where are you, and why are you here today?
Josh Barrett, and I'm over in Chapel Hill, North Carolina. So I'm the Associate Director of Research at the Center for the Business of Health. We're based out of the Kenan-Flagler School of Business. I'm also a PhD student at the School of Nursing. I look at behavioral health workforce turnover. And I'm here because the Center for Business of Health is actively doing an opioid settlement fund resource project. So we partner with NC Growth, an economic development group here, and we're going around having community sessions across the state to sort of learn best practices and gaps and develop some resources for folks.
Perfect. And Johnny, why are you here today?
I'm Johnnie Carswell. I'm a Burke County, North Carolina Commissioner, have been for the last 12 years, and I'm also president of the North Carolina Association of County Commissioners and involved with NACO. Also glad to see Greg here. We are currently in my presidential initiative in North Carolina that is entitled One More Thing. And what we're trying to do is enlighten all 100 counties on how they can spend their opioid settlement monies that we got here in North Carolina.
Perfect. And Rollie, why did I drag you here kicking and screaming? You're on mute. I mean, that's one way to start the process.
Here we go. Yep. My name is Rollie Martinson. I'm a policy associate here at Community Education Group. So my background over the years is in direct services. I've worked in treatment, prevention, recovery support services, and more recently in harm reduction direct services. And I was asked to be here because I'm the database lead for our Appalachia Opioid Remediation Project, where we track and monitor spending in the 13 states of Appalachia.
Right. And if folks have not signed up for our newsletter on opioid remediation or on our general newsletter, please do. Those guys and women are back there working really hard to just collect data so you'll know where information is. What I'm going to do is actually I'm going to start with you, Johnny. And the reason I want to start with you is because I did come to see kind of one of the projects. I know you're going to do many, but one of the projects you're trying to do with some of your opioid remediation dollars, and that's the rehab of that jail. So I know that's one of the big projects. Can you give the folks an idea of what your kind of strategy is in Burke County?
Well, currently we've developed about 8 different strategies that we're trying to use after the settlement here in North Carolina. The first thing we did is hire us a substance abuse manager director of our behavioral health program, Dr. Katie Varnado. Katie worked at our local MCO. We hired her, and she's going to, on our county funded money and our county supported behavioral health and substance use services. And she's also going to be responsible for facilitating our opioid settlement work group and project management. The second step in our program was to go in front of our county commission board and get our naloxone distribution, opioid settlement monies for naloxone distribution. A lot of people in Burke County did not believe in the distribution process, but right now we have our faith community, our paramedicines, and our public people involved in naloxone, and the program has gone on very well. Next, our third process is called our overdose facility review and our public health and safety team, OFR and FAST, which is the first of the kind in the state of North Carolina. And the purpose of OFR FAST is to do case reviews of overdose facilities and to evaluate public health data in relation to substance use. And this team is going to collect and review that data and then make recommendations to the Board of Health for policy and system changes to prevent future overdoses from occurring. Unfortunately, we're one of the highest counties in the state now for overdose deaths. So we're looking forward to OFR FAST to take the lead in overdose deaths. Next in our strategy process is called Peers for Partnering for Excellence, in other words, PPE. And this is, again, one of the first in the state of North Carolina for us to develop a peer support networking group in this state. These are peer support specialists. I really didn't know a whole lot about peer support specialists until I just dove into this thing just head on to see what it was about. And we can't do anything without this peer support. Next, we had community forums. Burke County has brought state and national subject matter experts to talk to everyone about the opioid epidemic. We've done this in a setting over at Comma, our municipal auditorium. We've had Beth Macy, who is the author of Dope Sick and Raising Lazarus. Also, we've had Dr. Stephen Lloyd on several occasions, and he will be coming back again to talk to us. And also the Secretary of the Department of Health and Human Services, Cody Kinsley. We do have our next step in a regional recovery ecology evaluation and regional partnership development. And the goal of this project is to inventory what resources are going to be available to Burke and the surrounding communities, and then partner with neighboring counties to develop a plan to work together to address these gaps in the recovery system. Next to last is something that we call Voices of Recovery, which is a video project where we will be able to do data collection when we interview individuals and have them talk and tell their stories. These are some of these stories are heartbreaking, as you probably are well aware. And then the last step we just announced yesterday, we have opened up a new website through the county health department that will have all the data that we have put together for everybody in the county to see. Hated to go so fast, but I wanted to make sure I got all of these programs.
Well, you know me. I mean, I asked you, and so I expected a full answer, and you gave me one.
Yes, ma'am. So I'm wide open when it comes to this project.
Right.
And that's just what we're doing in the county. And then again, my presidential initiative of one more thing is going really large in the state of North Carolina. I want
to come back to that one more thing. I want to come back to one more thing because I want us to talk about one more thing and kind of what sometimes really how it is that people who were not warriors become warriors. And that's what I think about that One More Thing project. That's how you became a warrior. I don't know that you were a warrior before that, but you are one now, and everybody needs a you in their hip pocket. Greg, tell me what's going on in West Virginia with our opioid settlement / remediation dollars.
Well, right now we've got a lot going on. Of course, the counties and the municipalities got the first tranche of money that came through that was not part of the overall settlement pieces. These were just direct dollars that do not go to the West Virginia First Foundation. That foundation was comprised of 11 members from throughout the state of West Virginia, one from each region specifically that was chosen by local elected officials. And then you've got 5 that were then appointed by the governor. And then those have now, they've met a couple of times. I think the most recent meeting was last Thursday. And so you've got people all over the state of West Virginia that have different expertise. A couple of elected officials, a few doctors. I know Dr. Christensen is one. You have a prosecuting attorney from the Eastern Panhandle, who's on there as well. So they're really starting the process of trying to figure out where those dollars are going to go. But the initial tranche of money has gone out to the counties. And one of the things that we've said through our state is that we want to make sure that we are very patient. We don't want to go into doing anything haphazardly. We want to make sure we put these monies in the best place possible. It does allow for 50% of the money to go to jail bills and remediation of past expenses put in. We have expressed as a commissioner, I can also say I've expressed patience in making sure that, yes, you can do that with your money. It may not be the best value for what you've got. So let's do that. Also collaborating together, figuring out ways where the region can kind of come together. Also cross-county partnerships. What does it need to do? How do you build and strengthen a community? So things like giving opportunities for families, extra programming, after school programming. There's a lot of things that can be done with this money, and we just want to be as broad as possible. In fact, to be honest with you, Johnny, we've learned a lot from North Carolina. I've worked with several of the people there. We came down, I met with Steve Mange. It's been probably a year and a half ago, and it's really kind of revolutionizing the system and giving the counties more direct money to allocate these resources. And I think that's great because it kind of gets the state out of the way, and it lets people solve the problem at the local level. So, we're pretty encouraged with the way things are going in West Virginia. We're hopeful that everybody's going to work together. Sometimes it works, sometimes it doesn't. But one of the things, we sort of got a precursor with the American Rescue Plan funding from the feds. That kind of gave us a template in ways to work together. And I'm hopeful that the state will use the auditor checkbook to be accountable for all these monies. And then let's see how it can go forward. I know we've got about anywhere from 12 to 18 years of good opportunity to change communities. And so we got to spend it wisely.
And so, I come to this for a couple of reasons. One is that my goal, my mission, our goal is to help as much as we can to make sure that these dollars that were built on the backs of the families, the communities, the towns, the hollers, the people that we know and love, that some of these resources get back to those communities, those homes, those families, those honestly, those kitchen tables. And so what we want to do is make sure that we have as much information as humanly possible that's available to anybody who's seeking those resources. So, Rollie, can you tell the folks kind of like what you're collecting, why you're collecting it, and why, every night you're having, instead of sugar plums dancing your head, you're having county records dancing your head?
Yeah, sure. So we focus our efforts on the 13 states of Appalachia, and we're primarily looking at spending at the more local level. So jurisdictions like counties, cities. We also do monitor decisions of like state decision-making boards. And we're spending a lot of time trawling through minutes, watching videos. Depending on the jurisdiction, it can be challenging to find information, depending on how transparent those processes are in general. So we're looking for any hints as to how decisions are being made, or where folks might think how they might be prioritizing their decisions. And then we're also, of course, looking for any like specific allocations that we can verify.
Perfect. Thanks. And that becomes important again when we try to make sure that these resources get back to local and county communities, or again, homes, into treatment programs, into supporting organizations that might need prevention education services. Those are the kind of things we want to make sure folks know how to get those dollars. Josh, what's your group doing?
Yeah, so we're kind of engaged in a resource development two ways. So we're kind of doing qualitative and quantitative work. So we're working on the quantitative side. I have a health economist and myself and some others trying to model out kind of like traditional return on investment ideas in terms of like if our county, puts 100,000 into this abatement strategy, what are outcomes? What are, quality adjusted life years? What's the return? Sometimes you want to break it down to a fiscal sort of explanation of we're investing this much. What do we really get out of it? Like, is this going to mitigate EMS costs? Is this going to mitigate hospitalization, healthcare utilization costs, that sort of look? Our other project, and the one where I'm doing a lot of work on right now, are community conversations. So this is the qualitative work. So we're going across the state. We're already about 75% done. So we've gone around we kind of think it's important to gather the local context and input rather than sort of just make blanket policy recommendations of, hey, y'all should do harm reduction. Here's the evidence for it. A lot of times it doesn't connect. A lot of times you need to go down to the counties like Robeson or get out east to Havelock and Carteret and others. Like, okay, why are one of you doing safe syringe programs and the county next door is not? or why are you investing in this and you're not? So there's a lot of context that is completely missed if you don't go into these communities and sort of just have a forum and ask, well, how did you set up your post-overdose response team versus this county who wants to try? What can they learn from you? So there's a lot of good sharing that can go on, but there's lots of gaps. So we're trying to really understand what are best practices that's occurring across the state and stuff we can translate and give to other folks. Because a lot of counties, we'll go out and there'll be a county that already has a post-overdose response team, did the foundational work, understands all the nuance that goes in with it. And then the town next door wants to start one. And they have no idea, but they don't have to reinvent the wheel. They can go ask their neighbors, hey, how have you done this? What are some pitfalls? What should we look out for? But beyond, like, if they don't have those connections made, there's really no other resources. They have to sort of go and search Google and go to other databases and try and find this stuff. So there's a way to just sort of pool general resources that counties could really use. So another gap we sort of noticed is around the RFP process and sort of the grant management. So some counties, if for fiscal year they get $2 million in settlement funds and the county has one grant manager, and then there's a whole RFP process, a lot of folks who submit their RFPs, some of the local health service providers and organizations, maybe they do transport, maybe they do peer support specialists, stuff like that, counselors, they'll want to submit an RFP. They don't know how to do that. Like, that's not in their skill set. They don't have the time or the bandwidth, or if their RFP gets rejected and the grant manager says you need to adjust this and this, like, they don't know the jargon. They don't know how to readjust their sort of management. So there's a lot of ideas we're thinking of like, okay, how can we just point people to existing grant management resources? There's a lot of great resources. There's a lot of great university programs that sort of host classes on here is how to do a grant, here is how to revise it. But there's a lot of gaps. You go county to county and these people know how to do grants. They have many managers that can help. These people don't. Like, how do you just connect them? They can help you all out. So it's a bit of quant and qual work, and this will be a front-facing sort of website, the same as various other ones that sort of points people to, hey, if you're a clinician and you might have these issues, go here. If you're a county commissioner and you have these questions, go here. These are peers doing this. So that's our work right now. Still a lot to do, though.
Right, but actually, Greg, I'm getting ready to come back to you because I know I'm going to lose you. Is a bit on this, right? I think one of the pieces is that this is a lot of money that is coming into health systems across a number of states, and I think it was you, Greg, who said over about an 18-year process, right? Some people are going to get big tranches up front, and so there'll be heavy investments up front. But then there'll be resources that are coming out over time. I also think that one of the challenges is that this money is not hitting the system the way many of us think about healthcare or health-related dollars hitting the system, because it's going to get to the commission, but it's starting out through the AG's office or through a commission office or through a commission process. So I'm wondering if you could all talk about kind of what you're seeing for this kind of granting process, or let's say, I don't want to just say granting process, but I want to say community access and community education process. How does the community know how to get the access to these dollars? And what I want to say is that when I define community, I'm talking from the small community-based organization, which might be doing harm reduction, needle exchange, might be doing some sort of lived experience or prevention, all the way up to a large hospital system, which might be doing recovery work. How do they know what you got to give them, and how do they know what's in your wallet?
I'll jump in really quickly on this one. I think one of the main things that we've discovered within West Virginia is that we're trying to come up with those database solutions where we know what's available in the communities we serve. So we know that prevention coalitions exist in multiple counties. Some of them are good, some of them, need a little bit of tweaking and so on. So I think that's one of the big keys, is identifying the resources that are currently available, and then going outside and looking at other things, like what does CIT training look like for all of our law enforcement officers and all the first responders? What do quick response teams do within that 72-hour period where you've got an overdose? How do you map those things? And I think that's another key point, is that we don't do enough resource allocation and mapping within particular geographical areas within the county, or within the state, the region, wherever. But, we need to figure out where those things are occurring so that then we can go put the adequate resources within those areas that are the most dire. So I think that's going to be a big process moving forward. I mean, we've started working on things like using ESRI for dilapidated properties and overdose deaths. And, we started to identify places within our own region that we now know that are hotspot areas where if we take care of that, we put more prevention strategies in that area, we've got a greater chance to kind of knock those down. And I think that's been a big help. The other thing about the money issue is I hope, and again, we'll know a lot of this coming out after West Virginia First kind of gets up and running broad based. They just hired a director a month and a half ago or so. I'm hoping that they take the data, they look at these needs, they find out what resources need to go in. And there's two things I hope they do. Number one, don't forget the smallest communities. Don't go to the population-based centers. I have a problem when you spend a lot of money in areas that already have a lot of resources and that you don't, really go to the root of the problem. You may have a smaller community, but if substance use is happening in those communities, it's probably a lot more impactful than a community that has a lot more resources. So don't overlook the smaller communities and put the resources where it belongs. And then the other thing is kind of what Josh alluded to, and I spoke about this last week on a couple of calls, is, a lot of this money needs to be there to provide the resources. There are a lot of federal funds that are sitting out there that go wasted, that they do not come into areas that we see in Appalachia, we don't see in West Virginia. There's a lot of areas that if we had the good grant writers and the ways that we could collaborate on a regional or even a statewide level, we'd be a lot stronger because we leave dollars on the table each year. So I think if you leverage these dollars and invest in the environment and you invest in the technology and you invest in the actual personnel, you're going to have longer, sort of ways to become benefits of this money.
But Greg, when you say invest, now are you saying invest within the state, county, local health department, or are you saying invest in community-based and state-based organizations? I mean, because there's infrastructure investment that I think kind of the state needs, right? But then there's also, or county commissioners such as yourself that you need. But I think that there's also kind of do community-based organizations have the capacity to create these responses as well?
Well, I think Johnny would argue this with me. I mean, the best resource is local. I mean, you can go through the state and that's fine. I mean, there's going to be a lot of great opportunities through the state, but sometimes those things don't transcend down. And that's why, I'm constantly arguing that counties can do this better because we know our people better. We know where the resources need to go and we know how to put them into place. It's just we have to get the education in which to make those decisions better. And I think having the collaboration with our municipalities who also get some of this money, making sure that we're not tripping over each other, and then figuring out where these resources need to go to make sure we solve the problems. I believe money should be kept local. I mean, you build local, you keep local. And, we've seen that with the American Rescue Plan funds. When we invested into long-term strategies and not flash in the pan kind of things, we know we've had a better impact. And I think that's the way these money should be spent.
Now, I'm going to go to Rollie because Rollie, when you look across the 13 states, and are you seeing that the resources are being maintained locally, distributed locally, or are they going state and out? Or what are you seeing? Let me not put words in your mouth.
Yeah, it's tough to generalize just because everywhere is different. But in general, I can say for every jurisdiction, actually, it's a political process. So the monies tend to go to whoever is most persuasive at the local level, whether that's like a county, if you have like a single county treatment authority, or whether that's the local sheriff's office. And I think an issue with that is that they're not always advocating for evidence-based interventions. You might have like a prevention coalition advocating for programs or approaches that make the problem worse, that could result in more overdoses. So one of the things we try to do through our newsletter is alert folks to any opportunity for civic engagement, whether that's a town hall meeting or maybe a decision-making committee is accepting written requests. Because I feel like in most of our region, there are two big things that are missing in the jurisdictions. One, I'm not seeing them prioritize the health and well-being of people who use drugs and people with opioid dependence. These are the folks who are dying right now. And two, the other issue I see is how we look at prevention. So under the guise of primary prevention, often we see like just say no programs or rallies that look good, feel good, sound good, but don't really have any evidence that we're going to see any long-term health outcomes. So I'd really encourage decision makers to think about how we look at effective prevention. So we're looking at conditions where folks work, live, they play, and the lack of economic opportunity, financial, housing instability, physical pain, feelings of despair, untreated mental health issues are all drivers of possible substance misuse.
Right. So, all right. So, Johnnie, now, Greg keeps patting you on the back. I think you're going to try to get a loan from some of your money. I think that's what's really going to happen. But maybe I'll tell him for you. He broke as a bag of glass. He don't have it. So, Johnnie, tell us a couple of things. One, how are you engaging with community, as I defined it? But also, I want you to tell the people about your project and how you came to this work and how you're a convert.
Well, as Greg will agree, North Carolina is the leader when it came to how the money was distributed into the state and into the counties. During the lawsuit, we developed something called the 555 Committee, 5 county commissioners, 5 county managers, and 5 attorneys from North Carolina that sat with Attorney General Josh Stein and his staff, including Steve Mange. When we originally started out, 90% of the money that was going to come from the settlement was going to the state and 10% was going to the county. Well, obviously, we did a tap dance as county commissioners on that desk, and by the time we were finished, 85% of the money was coming to the county and 15% was going to the state. And that actually has gone up to 90% right now coming to the counties and 10% going to the state.
Hang on right there, Johnnie. Greg, what's the percentage in West Virginia, state and county?
So it's going to vary. Right now, we did get the initial tranche, which came external of that, but I think through the West Virginia First Foundation, I want to say that it's I want to say the state's going to control 70. I think it's 73%. I think is the number.
Okay.
And then that'll be fed down through the highest populated highest populated county. They're going to be the ones that control the particular region. There's 6 regions in the state.
All right. Now, and I want to highlight that because I think that there's a difference in the two. Go ahead.
And then we received our first monies here in Burke County. There was a formula that was developed through the Attorney General's office. Unfortunately, some of the counties with less, I don't want to say they have less problems per population of SUD, but again, Burke County was one of those that have a lot of SUD problems. We've already received $3.5 million here in Burke County. We're leveraging that money, as you already are aware, to do a regional health center here in Burke County. What we're trying to do across North Carolina is to do 4 regional health centers. But the Attorney General's office is 100% behind everything that we're doing. And working through NACO, we have shown our model. As Greg knows, he's seen this model and has actually talked to Steve Mange about the model that we're using. We just last week, Greg, got Ernie Richards from West Virginia. He will be doing some of the legwork for us in developing our project here in Burke County. Now, NCACC, the Association of County Commissioners, as I said, we are going through the One More Thing project, and that's my presidential initiative for this year. As most everyone knows, we lost our son to an overdose, and so my wife and I, she at one point in time said if we could have done one more thing. So that's what I'm doing around the state now, going around telling every county, if you do one more thing and we put all 100 counties together, we've done 100 one more things. And so that's the type of program that we need. And as a leader here in Burke County, the 8 different things that I told you a while ago with the new dashboard that we're setting up that's called BCOR, the Burke County Opioid Response. We're teaching each of the counties, as Josh talked about just a few minutes ago, we as the association probably again are the leaders in each of the counties, showing them how to utilize their money under the A program and the B program, which is part of the opioid settlement monies. Regionalization is the key. So we're trying to do our facility in the West. There is a good facility in the Piedmont East called TROSA that has a really great program. So if we could set up the 4 regional programs and get the counties to take their opioid monies and put it into the regional concept, it takes that burden. What's going to happen in Burke County? We're not going to use 1 red cent of tax money. This is all through grants. It's all through the opioid settlement monies, and we will not have to use $1 of tax monies to do the project here.
So Johnny, have you had community pushback on what you're doing with these dollars so far?
Oh, absolutely. Yes, we've had community pushback. We just in the primary election right here, the 3 opponents running against the 3 commissioners now in Burke County, that was one of their mantras, that they would not vote for a regional concept for a center, because they had the typical things of it would be bringing drug dealers and drug addicts to come into the facility here. But, you know, we got to remember that right now, I believe, number one, there's a stigma that's associated with SUD, and we got to get rid of that stigma. And I could sit here for another 2 hours and talk about stigma, because overdose deaths in North Carolina have doubled in the past decade. It's up to about 22%, and it's disproportionately shouldered by communities of color, American Indians, the indigenous North Carolinians, and it's increasing in the white population also.
All right, and so Josh, as you're going around, what are you seeing as far as community engagement in these processes? I know you're doing qualitative and quantitative data gathering and all of that, but in order to do that, you got to talk to the people. What are you seeing with the people or hearing with the people?
Yeah, so it's pretty, there's a lot of variation we've noticed. So everything's pretty, there's a lot of heterogeneity to it all. I think what we're seeing a lot is the awareness. There's major awareness gaps dependent on if you're from the local health department, you're county commissioner level, or you're a concerned citizen, or you're a nonprofit who perhaps handles harm reduction services, something like that. A lot of folks, you know, we've gone into certain cities and had conversations, and there's those actively in harm reduction services, and like, I've never heard of the settlement funds. I had no idea, you know, city got this money yet. I had no idea it's going out. I was not part of the needs assessment. What is the RFP? What are the timelines? So there's major gaps, really just from town to town in terms of awareness. So we've talked to local governments in terms of how they're sort of trying to market it. A lot of it is sort of a marketing issue of, do we just put it on the county government website? Do we get local radio? Do we put things on billboards? So there's, you know, a lot of funds are not always denoted for building marketing and awareness of these projects. So really town halls and other stuff like that, they go a long way in terms of like word of mouth, because a lot of those harm reduction groups, they're pretty tight-knit groups, we've learned. So when one group learns of something or attended a meeting that a commissioner was at, that sort of gets disseminated across the group. But there's a lot of variety in counties on how they're going about that, or educating the folks in their community that can do certain things. The other thing we've noticed, it goes back to the sort of awards and RFP process and the grant management of it. There's a lot of concern, and it's a bit of risk mitigation too from the county side, is a lot of these awards are 1 fiscal year. So you'll see, you know, we're servicing this company to help with transport, $100,000, and it's denoted for fiscal year 23 to 24, something like that. A lot of them are concerned of, you know, if they get that process going, if they hire a bunch of people, you know, we have active grants, we have funds, and then, you know, next political cycle or the county commissioners change over or things come, that grant money, it's not guaranteed fiscal year 26, 27, you're going to get any money to go for this process. So there's a lot of hesitancy, and I think there's rationality to it of, maybe it's a new company and the county says, okay, we'll award you a 1-year grant, see how it goes, see if the outcomes are what we want. But then there's the response from those receiving it saying, it's a little scary to have a limited runway, and I don't know if in 1 year our post-overdose response team is going to get a grant award again. So there's a bit of a disconnect in terms of, you know, how do we make sure we're sort of doing financial sustainability and investing in strategies and companies that really work, and giving people ample runway to sort of, well, let's build a team of 10 peer support specialists and go for it. But, you know, if you're not guaranteed funding beyond like 1 fiscal year, it's hard to convince people to get involved in that. So those are sort of the 2 main ones that come to mind around the awareness and then some of the award gaps.
Rollie, what are you seeing around the region as far as how communities are getting involved or how they're finding out about these resources, that sort of thing?
Again, that one depends largely by jurisdiction and by state. So I know, for example, in North Carolina, we have seen like more town halls than in most places. And for example, in South Carolina, their board doesn't communicate with the public, but they do have their grants administrator hold a coffee chat once a month with an opportunity for input. And then a lot of it just falls down to how engaged are folks in general already with their like city councils or their county council.
So are you saying that it's more of a public access? And I'm not trying to lead the witness. I'm really trying to ask the question I think that other people want to know, which is, more blanketly throughout the 13 states of the Appalachia region, how are folks learning about, first of all, and then figuring out how to access these dollars?
Yeah, so I'd say those town halls are some of the best examples. Most often, it's difficult to know when an opioid settlement issue is going to be heard in front of a local council. When are they going to talk about it? And then oftentimes I also see that the decisions, they've already been made beforehand when there is a public hearing. So for example, maybe it was passed off to like an opioid settlement task force or some subcommittee. And once it's in that on our side of things, it's tough to track that because there aren't public minutes or anything.
Okay.
And then maybe they're just adopting those recommendations.
Okay.
We don't know.
All right, so I'm gonna double back to you. So what I mean, I think sometimes, I think, people may have heard of this before, like the roses and the thorns. What's the rose? Okay, we know North Carolina had the best dashboard, everybody on the face of the planet. We know North Carolina's doing everything better, including Johnny. But what's the best model you've seen around community engagement and maybe the worst? Or what's the best you've seen kind of service delivery wise, and what's the worst? Or what's the kind of best like you've seen in notes and all of that? And then what's like one of the most egregious examples you can give? Because there's really like what, 3 or 4 buckets that this money is supposed to be spent in, right?
I guess, yeah, and that's an interesting point, the buckets. So maybe I'll focus in on that. So in terms of transparency, so I'd say Colorado, even though it's not one of the states we track, they are the most transparent in the country. I can go in there, I can see specifically what programs are being funded and what the ask and anticipated outcomes of those programs are. Whereas like North Carolina, we look at their state dashboard, it's more general buckets of treatment, prevention, harm reduction. And that doesn't always tell us the whole picture. Like I know even within North Carolina, facilities who like bill themselves as treatment don't actually offer medical treatment, right? They offer like abstinence only faith-based services, which isn't an allowable use, but that'd be more appropriately, in my opinion, like recovery support services.
Right.
And then in most places, what we see is like maybe like, for example, South Carolina, they're reporting it's like an organization. So I have organization XYZ was awarded $100,000 for recovery support. And to me, that doesn't really tell me much at all.
Okay. How about you, Josh? What are you seeing kind of high level, great, working great, low level, not working so great?
Yeah, I think it goes to sort of the transparency around what is the county investing in. So some local governments, they're pretty great at hosting routine meetings, and you get those meeting minutes, they recorded it, and then they're quick to deliver the documents of, we decided to go, $100,000 to this strategy, and here is the firm receiving it. This is their history, a little behind them and stuff. A lot of groups are slow, even on our ncopioidsettlement.org, like the large state-facing dashboard. I think of 100 local governments and counties, I think it's like 58 have reported out what they're currently doing. So there's some that are just sort of really delayed in terms of like getting the documentation out there. You may talk to them on the phone and they'll be like, oh, we've already decided we're going to go with these 10 strategies, but you can't find any history of how did they come to that decision, who was queried, how did the community give input. So yeah, there are, I would just say those are sort of the two. It's the folks that are really, you can go on the website, you can easily see this is what those folks are doing. And then there's some, you kind of just have to call a number, hope you get someone on the line, be like, have you all made this decision? And what came of it? So
Right.
it's all over. Yeah.
Right now, Johnny, what would you say from your commissioner seat? Because we're all looking at it from the outside in. What from your commissioner seat would you say is the rose and what's the thorn here?
Well, the one thing we have to remember is Josh prompted me, and I forgot to say that there was only 17 cities in North Carolina actually got money from the settlement itself. And most of those cities decided to give their money to the counties. So the rose in this is that most of our counties now, we got to remember that Nitty Sats Diva in NCACC is our go-to. And we have, like I say, we have made presentations in all counties right now. The problem is with some counties, for example, I don't want to pick on Washington County, but Washington, a very small county, they don't have the resources probably to have the community forums like we have had here to get Dr. Lloyd to come and to get Beth to come, and talk. And we've done that on numerous occasions. So that's the downside of it. The money will be coming for 18 years, though. But some of the counties that did not have the problems with SUD like we had here, they're not getting the kind of money that we get. There's some of them, it's only getting thousands of dollars each year, and they're not going to be able to I don't think they'll be able to have great programs in that particular county, but it should be a regional approach. That's the reason I'm saying I don't think Washington County can do it by itself, so they're going to have to look at a regional approach in Washington. That's the thorn. They just got to get to original. I think that's the answer to all of it. I hope Josh will agree with me on that, that the original approach is what we should be looking at right now, because some of the counties, here's what we found out still, as much information as we put out, there are still commissioners, and commissioners change over. Unfortunately, they don't have a clue what this program is about and how the money got there, and they don't even know about the lawsuit. So unfortunately, turnover like that sometimes hinders a program when it's getting started. Fortunately for us, our health department is in charge of everything that we're doing with Danny Scalise and Dr. Varnado, her being in charge. And then on the state level with Nitty, with NCACC being our go-to there, I think a lot of people have now learned what they need to be doing to get the message out.
Well, let me ask you this, Johnny. So, like for a county like Washington, what's the plan to bring them along? I mean, because a couple of $1,000, 10,000, $100,000 a year for 20, that's enough to get you in trouble. That's
Yes,
to me, that's not enough money to really do something. That's enough money to get you in trouble because you start thinking you can do something. And then, the other thing I think that happens is that you say, well, oh, I got some of that opioid settlement money. And so they're thinking you got millions, and you're like, nope, I got Yugo money. I didn't get I didn't get GMC one. I got Yugo money. That's what I got. And so, like I say, so is there a plan? I understand, and I agree, and I support a regional approach because I think that sometimes you have to augment and support these smaller jurisdictions that don't have it, but sometimes they don't know what they don't know. And so then it can become like, why are you reaching your beak over here to get in our business? But what's the plan to bring along a county like Washington and to support a county like that?
Well, fortunately, we're divided up into districts, and Washington being part of District 3 or 4 down there. We have the district meetings, which we're in right now. And what we're doing is having Nitty to go to these district meetings along with Kevin Leonard and Amy Basin to talk about legally and from Nitty's standpoint how the regional approach would work. And we convince Washington that they cannot do it by themselves. Here's the thing about it. I think their commissioners are smart enough to know they can't do it by themselves. And they're asking us. We get a lot of questions. Nitty gets a lot of questions from the counties. How can I be a part of somebody else's program? People just don't have the resources in the small counties to do it.
Right. So, Rollie, are you seeing others take this regional approach or taking a type of regional approach?
Yeah, in some states, it's built into their state MOU. Other ones like South Carolina, it's not built into the MOU, but the our state board has incentivized that approach.
And what's the incentive? Say more about that. What does that mean?
Yeah, so in South Carolina, they've made the application process to get $25,000 for regional planning. Very simple, very easy. Just it's almost a certification saying yes, we'd like to do this, so they can go ahead and get that money and start contracting with who they might need to do that planning.
Okay. And Josh, are you seeing these regional approaches in the work that you're doing? And if so, are they working? Is it working?
Yeah, so we've seen both formalized and informal sort of gatherings. So, Commissioner Carswell was on point with a lot of, it's a good idea. Some folks are further ahead in the process than others. So when we went out east, I don't think they have like a formalized Eastern Commission or a group and stuff, but a lot of them have collaborations between neighboring counties and cities that, probably down the road could formalize themselves into a real gathering. There is one out west. We're actually going to them at the end of the month. It's a Southwestern NC Commission that is sort of like Jackson, Macon, Haywood, Cherokee. I think it's like 7 or 8 counties that are sort of a Southwestern Commission out there. And they have sort of an opioid model of let's come together. A lot of these, you really can't do it on your own. If you're the Franklin or the Cherokee out in the West, you don't have the resources or the managers for a lot of these programs. So they've developed that commission consortium model. Yeah, I think it's a great idea in terms of we're starting to learn, or I guess we will see when you give it locally to 100 different counties and 17 cities, there's a lot of difference in the capacity and bandwidth between this county and another county. So the ones with less resources really need to sort of rely and band together in a group. And I think it also sort of mitigates some of the issues folks have with the political nature of it coming down to a county commissioner decision level. It's like if we can come together as a consortium and we can all agree on these harm reduction efforts, maybe it'll.
Uh-oh. Did he freeze? Uh-oh. It looks like he's got some of that broadband from Appalachia. Uh-oh. Yep, looks like he does. So, all right. So we've got about 10 minutes left. One of the things what he was touching on, and maybe Johnny, I'm sorry, Commissioner and Rollie, what you can do is to answer this for me. And that is the following thing, is the Native American communities have a different response to or opportunity here, or are Native American tribes or tribes that are state-based treated the same as commissions, or do they have to go to the commission like everybody else, or are Native Americans treated differently in these settlements? Anybody? Rollie, do you know?
Yeah, so in general, there's a separate set of tribal agreements as part of the national settlements. So they have their own contracts.
So can you say a little bit more about that?
I wish I could. Right now, a lot of them are just getting started, so the ball's kind of still in play.
Okay. So, there's a pool of resources that is for Native American, and as state-based tribes, they have to be recognized federally. Do we know, or am I just now asking too many questions?
Yeah, that's where I'm not sure on the nuances. I know that the tribes are getting monies, but I don't know how that actually how direct it is versus whether that's a redistribution within state.
Okay, perfect. Johnny, do you know anything about that? And
what I know is dangerous, and so I'm not going to jump into that. I'm going to agree with Rollie. It's a little bit different when you get to the Native Americans, how the process goes, and I'm sad to say that I don't know that entire process.
Okay, well, perfect. Well, I mean, that's a part of why we do this, is now we all know we don't know, and so hopefully in the next Appalachia opioid remediation newsletter, Rollie, there will be a piece on this in there. So that we can educate ourselves as well as other people. Like I said, we have about 10 minutes left. If you have questions, you can either come onto camera or put a question in the chat. But most importantly, Johnny, what is it that you hope that you will achieve in Burke County over the next, because I'm going to say the next decade, because I think you're going to at least be there that long getting this done. So over the next decade, what do you hope when you go to bed at night that you will have done in Burke County with these resources, or and adjacent?
Well, I hope we can get the regional concept going, and that we are able to touch the lives. Like I've said many times in my speeches, I hope nobody else has to bury their child. Yes, that's one of the worst things you could ever have to do. So I want to work very hard. And Tony, I don't think you're aware. Unfortunately, I'm not going to be here for the next 10 years because my election did not go well. I was not reelected. So that's one of the things that's worrying us right now. We're trying to put together every piece of this project that we can to make sure that we get it off of the ground before I leave office in November of this year. So like I said, the opioid deaths in North Carolina, have increased terribly, and there is that stigma attached. There are still doctors that will not provide MOUD, and so we've got to re-educate people. We did have a meeting in Durham last week with the Sheriff's Association because they need to be a part of this just like anybody else does. Unfortunately, there are probably still sheriffs across the United States that believe that certain people need to be locked up and throw away the key. There are still certain people that will walk right up into my face today and say, you're wasting money on naloxone, just let them die. Those things are still out there. And so I certainly hope not many people believe the way some of these other people do. So we're in a crunch right now. Time is of the essence to get these things built and get these rehab centers done in North Carolina. I still have a lot of people on our side to try to get the regional concept done. And we just received another, fortunately here in Burke County, we just now received another $3.5 million out of the DHHS department to help with our facility here. So I hope we get that going. We just got to get the story out there that these people are worth saving.
Now, well, I'm going to come to you a second, Rollie, but first of all, I did not know that you had not, but but that doesn't mean, even though you won't be in the seat as county commissioner, how will you continue on this path? Because I know you, so I know that the reality is, in fact, that you will continue the work even though you're not county commissioner. So how will you do that even though you're not county commissioner?
I'll have to do that through the health department. Our health department's taken the lead, and in most counties, the health department has taken the lead. So the health department directors in their association, they are all talking to each other. Because like I say, once again, I feel very comfortable that Burke County is in the lead with the programs that we've got going on out there. And our model of our eight programs that we've got going now is being fed to NCACC, and now it's going out to all of the 100 counties. So no, I'm not going anywhere, but my voice will be heard through the health department from now on.
Very good. So I wanted to make sure they all knew who you were, in your heart and your soul. Because like I said, this isn't, like I always say, this isn't work for the faint of heart. This isn't work for the weak. It takes a certain person to get in this work, and I don't think it always matters if they're in elected office or not. It helps if they're in elected office because it gets some things done and moves some things through, but I don't think that deters anyone's passion, particularly not yours. So you will always be my friend, and always that I will call you commissioner no matter what. Rollie, tell me what's going on. What we gonna do? What's our plan?
All right. I guess I'll talk about some of I'm not a decision maker, but I'll talk about some of my hopes for the decision makers. Number one is I think the biggest risk of repeating the tobacco settlements is if these funds are used for supplantation. There's not really anything in the settlement documents that prevents that. So that's using the money to repay debts or to replace current funding. Would definitely like to see all the funding go to expanding existing programs or creating new programs. Two, I do love that Commissioner Carswell. It's not just having all the funds go out the door immediately, right? I think a portion of the funds should be looked at for regional projects or like large scale long-term projects. Three, seeing the programs spent on effective programs. So we know there are things that are going to work in most every community that can immediately and effectively reduce overdose rates. So naloxone distribution, if it's done right, drug tracking, syringe service programs, overdose prevention centers. And then I'd also encourage decision makers to have some kind of evaluation or monitoring built into that funding. Another point to consider too is how the role of opioids in the overdose crisis has evolved into more of a polysubstance use crisis. So looking at strategies that consider the influence and treatment of other substances.
All right. Okay. And I guess I'll close out with what my hope is. What my hope is that we really see this as an opportunity to bring together voices that don't normally speak with one another. That it's an opportunity for local and county government as well as state government to talk with its community partners, to have people with lived experience as a part of the conversation. Everybody from our large scale kind of inpatient facilities to those that may be seeking an abstinence only model, but that it's not one size fits all. That what it is that we understand the breadth and depth of what it means to be a person with lived experience, and that is maybe different for every single person. So I hope that we can take these resources again and get them back to reinvest, and that's what I think of them as reinvestment dollars back into the towns, the hollers, the communities, the homes, the people, the families that we know. Because I think that there's so many families that this opioid crisis has broken. It's broken the backs of families. It's broken the backs of towns. And we've got to figure out a strategy to rebuild. And we got to figure it out together. And it can't be about your way is the only way or your way won't work. We've got to figure out how it's going to work for all of us. I always look at it and I think of it like when you're driving a clutch, you got to know when to kind of push in on that clutch and bring it back so that whole car doesn't kind of jerk on you and then fall apart or just turn off. And I think that that's what I don't want us to do, is to turn off to one another. And I think this is an opportunity for us to rebuild some communities and to rebuild community in a new way. So first and foremost, I want to thank you, Commissioner. If you all oh, hey Lee, can you maybe put up the picture from the McGruff, because Johnnie was there. Johnnie was there to witness my moment of greatness, and so we can share my moment of greatness with everybody on the call. So, Commissioner, I'm gonna call you John, because Johnnie, how excited did I get? How excited? Because Johnnie was the true witness. He wasn't.
I thought you were going to fall over and pass out when you found it.
I'm trying to tell you. I mean, they had to, they made me stop talking about it after a week. They were like, you can't talk about it anymore. I was like, come on now. I was like, this has just made my life. I mean, I was McGruff the crime dog and here we go. I was McGruff the crime dog for those of you that, Johnnie, just tell them again, how happy was I when I turned that corner?
You were absolutely ecstatic.
I was. I gotta tell you, I keep telling people, I honestly, I just didn't know. I mean, I didn't know if I'd been happier and forever. But again, you and Danny made that moment possible for me. And I hope I could give you a little bit of help with kind of figuring out some structures and strategies. With you guys as well. I call you friends. I don't call you just people I know. I call you you guys friends, and I hope to see you again very soon. Again, thank you everybody for taking time out of your day to spend an hour with us, and I look forward to seeing y'all next month. Thank you so much. Thank you, Commissioner. Bye. Thank you, Rollie.